Some hospitals have decided not to release data about how many COVID patients they're treating, how many employees have tested positive or have died. In order to understand how and why some hospitals are keeping that data to themselves, we need some context. My name is Joseph, and this is AJC in Context. Now, for this video, we will be sourcing a story from our very own Ariel Hart. If you want to read her story in its entirety, there will be a link down below. Now, while we're not able to pinpoint exactly when some Georgia hospitals stopped sharing COVID data, we do know our reporters have been repeatedly stonewalled, and after a highly publicized death, some eyebrows were raised. And that death was of a 42-year-old mammogram technician at Piedmont Noonan Hospital. She was found dead in her home, and the county coroner reported she was otherwise healthy, but she did test positive for COVID-19. And that story went viral. So viral, in fact, Piedmont Healthcare released a statement saying the cause of death was yet, quote, inconclusive. Quote, Piedmont disputes the cause of death, as reported by the Noonan Times-Herald. Days later, the death certificate was issued listing just one cause of death: COVID-19. This is important because we need to know if the individuals taking care of us are sick, especially now when we're asking more of our healthcare workers and hospitals than ever before. Now, public health experts say the strain on the system could be exactly what is making some leaders tighten their control of data. Some hospitals are trying to protect their brand from being associated with this disease, or some just think they're trying to prevent a panic. Now, that's not to say all hospitals are hiding data. Some have been meticulously transparent. However, Piedmont, Northside Hospital, and Wellstar Health System are among the hospitals refusing to release such data, citing privacy or even incorrectly suggesting doing so would violate the law. Now, reports compiled by the state, obtained by the AJC, show those three healthcare systems have treated some of the heaviest caseloads of COVID-19 in the state. Now, I do want to go back just for a second and talk about that law being cited by the hospitals. That law does not prohibit releasing anonymized data. That law does prohibit releasing any data that would make patients identifiable. Quote, there is no violation of privacy in releasing the numbers. Now, we spoke to a few experts to get their opinion on how important it is to release this information to the public. Releasing information gives people concrete evidence when preventative measures like wearing masks are working, said Scott Steiner, CEO of Phoebe Putney. They will all be important as flu season approaches, potentially doubling the impact of the coronavirus, said Christopher Fries, a professor of nursing at the University of Michigan. So with all that information, we want to hear from you. Does this affect what hospitals that you will go to in the future? Why or why not? Let me know any and all thoughts in that comment section down below. And hey, while you're down there, go ahead and press that subscribe button if you haven't already. We are back every week putting the news in context. Go ahead and press that like button if you liked this video, favorite if you really liked it. But as always, my name is Joseph, and this is AJC in Context.